Do I need to get dressed? My name is Joseph Healy, and I consent to Vanek Arai filming me for his assessment class.
Good evening, Mr. Joe. My name is Ben. I'll be your nurse practitioner today. How are you today?
I'm good. How are you?
Okay, good. Today we'll be doing 3 assessments. We'll be doing the HEENT, the neurological, and abdominal assessments. Have you been having any headaches lately?
No.
Any hearing loss?
No.
Recent nosebleeds?
No.
Change in vision?
No.
Any vertigo?
No.
Dizziness?
No.
Sore throat?
No.
You feel like your goiter is enlarged? Swollen glands?
No.
Okay. So I'll be checking your head and your hair, your scalp, okay? That head is symmetrical. There is no nevi lesion, parasites. There is some dandruff noted. Scalp is symmetrical as well. There's no depression. Face, it has symmetrical facial expressions. Eyebrows are symmetrical. Skin is clear. No papules, acne noted. Skin tone is normal for ethnicity. There are things in this video where I don't have proper equipment, so we will pretend to use things like the tuning fork, otoscope, ophthalmoscope, and just pretend that we're using them instead. Okay, I'm going to be inspecting your eyes, sir. Alright, sclera is clear, so is the conjunctiva, no drainage noted, no nodules noted. I'm going to be shining a light in your eyes, okay?
Mm-hmm.
Okay. Pupils are equal reactive to light and accommodation. I'm going to pretend to use an ophthalmoscope for your eye. Please look forward, sir. Alright, disc margins are sharp, no hemorrhage noted, no exudates noted. We'll be going on to the cranial nerve portion of the tests. Cranial nerve 1 is typically skipped during assessments. However, it is olfactory. The cranial nerve was smelling. Are you able to smell certain odors and senses without any problems?
Yes.
Okay. Cranial nerve 2 is optic. We'll be doing the Snellen chart, which I have placed on the wall. Can you cover your right eye? And can you read line 3, please, Joe?
It's LCD ZOTEP.
Okay. I'm sorry. I meant line 3, line 5, and then line 7.
Sorry. ZLPED.
Okay. How about now cover your other eye and repeat the same line, sir.
ZLPED.
Okay. Now go to the next line, line number 5.
DPCZLFT.
Okay, cover the other eye and repeat it again.
DPCZLFT.
And lastly, go to line number 7 and read that line for me, please.
LCDZOTEP.
Okay, and one more time with the other eye.
LCDZOTEP.
Okay, good. Mr. Joseph here has 20/20 vision in both eyes. Then we'll be checking cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducent. Okay? I need you to follow my finger and just follow with your eyes while your face is facing forward. Okay?
Mm-hmm.
Okay. Okay. Good. There's no nystagmus, there's no ptosis. Convergence was positive. We'll be checking cranial nerve 7. And if you can just clench your jaw for me. Okay, very good. Strong jaw. And we'll be testing for sensation. I'm going to be touching different parts of your face. And let me know if you feel sharpness or dullness. Okay?
Dull. 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 Sharp. 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 Sharp.
Okay, very good. No deformities or deficits there. Next, we'll be checking cranial nerve 7, which is facial. Can you smile for me? Okay, raise your eyebrows both and puff up your cheeks. Puff out your cheeks. Okay, good. They're all symmetrical. Show your teeth for me. Okay, great. Cranial nerves 8 is acoustic. I'll be testing for your hearing. I'll be whispering something to you and you repeat it back to me, okay?
My name is Joseph Healy. This video is awkward.
Very good. I do not have a tuning fork, so I'm going to pretend that this pen is a tuning fork. I'm going to test for lateralization of hearing. So let me know if you hear the noise in either side of your ear more.
No.
Okay. Now that was the Weber test. I'll be doing the Rene test, which tests for air conduction and bone conduction. Let me know when you hear the ringing stop. Oh.
Now. Now.
Okay, air conduction is greater than bone conduction, which is normal. Cranial nerves, where are we now? 9 and 10, which is the glossopharyngeal and vagus nerves. Can you please tell me your address?
14 Springton Circle, Maysland.
Okay, can you say ah?
Ah.
All right, and I'm going to test your gag reflex. Just open your mouth wide.
Ah.
Okay, good. Gag reflex is positive, and patients able to speak clearly without any deficits there. Cranial nerves 11, we'll be testing the accessory muscle. If you could do me a favor and shrug your shoulders. Shrug your shoulders, meaning put them up. Very good. Keep them up. Okay, great. Strong. And no deformities in the spine or muscles. Then finally, cranial nerve 12, which is the hypoglossal. And we're going to be looking at your tongue. Can you open your mouth, stick out your tongue, move it side to side? Good. Tongue is symmetric. Patient is able to move his tongue. All right. Once again, I have no otoscope. We'll be looking at your ear, so we're going to pretend that the cell phone is an otoscope, okay? All right. No tenderness, no drainage?
No.
Great. Okay. We're looking through your ear, okay?
Mm-hmm.
Okay. No discharge seen, no foreign objects, no redness or swelling noted. On his right ear, as well as his left ear. The nose, once again, I have an otoscope. Any drainage from the nose? All right, can you lift up your nose? I'm going to look at each nostril. Great and great. There is no drainage, no polyps, no exudate. I'm just going to be palpating your face, okay? Your sinuses, no tenderness there, sir?
No.
Okay, good. Open your mouth. Ah. Okay, throat is, lips are moist, oral mucosa is moist pink. Patient seems to be hydrated. No lumps or ulcers noted. The gums are pink. Teeth are semi-white. A little crooked, but oh well, I guess he didn't have braces back then. Can you please sit up, sir? I'm going to be palpating for your, what's it called, lymph nodes. No tenderness, no swelling, no swollen lymph nodes noted. in the posterior cervical chain and anterior cervical chain. Lastly, I'm going to be looking at your feeling your trachea. I don't feel any nodules. The the thyroid does not seem to be enlarged, and the sternal notch is midline. That's it for the HEENT portion of this assessment. We will see you later for neurological and abdominal.